For the application of the surge Faradic current, in the machine there is a one light which shows the contraction period and the relaxation period. The light is on when the contraction period is start and the light is off when the relaxation period is start. We have to increase the intensity when the contraction period is start. It means when the light is on, we have to increase the intensity. If we increase the intensity in a rest period, it leads to chances of electric shock.
There are various types of machine for the electrical stimulation. This is the one type of machine. The first knob. First knob is for the choosing the current, galvanic current, interrupted galvanic current, Faradic current, surge Faradic current, etc. If we can choose interrupted galvanic current, so there are two other knobs for the interrupted galvanic current.
For selected parameters,
We can select the pulse width and frequency for the interrupted galvanic current. When we can choose that, then we can increase intensity gradually. For the application of the surge Faradic current, there are two knobs: contraction period, relaxation period. More electrical stimulation. There are two types of current which we can use. First is interrupted galvanic current and second is Faradic surge current. In interrupted galvanic current, we can choose frequency and pulse duration. We can set frequency 1 to 5 Hz and pulse duration 100 to 300 millisecond. In surge Faradic current, we can choose frequency and contraction period and relaxation period. Frequency we can set 50 to 100 Hz and always set relaxation period is always greater than contraction period. RP is greater than CP. What is motor point? We can say that a small area on a muscle at which a minimal amount of electrical stimulation will causes the muscle to contract. So we can see a visible contraction. How much intensity we can set in electrical nerve stimulation? So there is a visible contraction at minimal intensity, not a much intensity we can set. Axillary nerve, which is supply the deltoid muscle, anterior fibers of the deltoid, middle fibers of the deltoid, and posterior fibers of the deltoid. For the axillary nerve, reference electrode we can place at the C7 cervical spine. This is the C7 cervical spine for the reference electrode. This is the motor point of the anterior fibers of the deltoid.
Good.
This is the motor point of the middle fibers of the deltoid.
Good.
This is the motor point of the posterior fibers of the deltoid. Musculocutaneous nerve of arm, which is supply the biceps brachii muscle. This is the motor point of the biceps brachii muscle. This is the contraction.
Good.
Radial nerve, which is supply the triceps brachii muscle. Triceps brachii, there are three heads: medial head, lateral head, and long head. This is the contraction for the long head of triceps brachii. This is the contraction for the medial head of triceps brachii. This is the motor point for the long head of triceps brachii. This is the contraction for the lateral head of triceps brachii.
Motor point.
This is the motor point of the lateral head of triceps brachii.
Done.
For the axillary nerve, radial nerve, and the musculocutaneous nerve of arm, reference electrode we can place at C7 cervical spine. Median nerve, muscle supplied by median nerve. Pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, flexor digitorum profundus. Reference electrode we can put on the cubital fossa. This is the motor point for the pronator teres muscle in the search Faradic current. Action of the pronator teres is pronation of the hand. This is the motor point for the palmaris longus muscle. The action of palmaris longus is flexion of the wrist joint. This is the motor point for the flexor digitorum superficialis muscle. The action of flexor digitorum superficialis is flexion of middle phalanx. Median nerve is also supplied in the thinner eminence of the hand. There are three muscles in the thinner eminence: abductor pollicis brevis, opponens pollicis, and flexor pollicis brevis. This is the motor point of the abductor pollicis brevis muscle. The action of abductor pollicis brevis is abduction of the thumb. This is the motor point of the opponens pollicis. Action of the opponens pollicis is opposition.
Opponents.
3. This is the motor point of the flexor pollicis brevis muscle. The action of flexor pollicis brevis is flexion of the thumb. This is all three motor points of the thinner eminence. Radial nerve. We can put the reference electrode at the radial groove of the humerus, and or we can put the reference electrode at lateral epicondyle of the humerus, behind the lateral epicondyle of the humerus. This is the motor point for the brachioradialis muscle. The action of brachioradialis is elbow flexion. This is the motor point for the extensor carpi radialis longus and extensor carpi radialis brevis. The action of extensor carpi radialis longus and brevis is extension and abduction of the wrist joint. This is the motor point for the extensor digitorum. The action of extensor digitorum is extension of the digits. This is the motor point for the extensor indicis muscle. The action of extensor indicis is extension of the index finger. This is the motor point for the extensor digiti minimi. The action of extensor digiti minimi is extension of the little finger. ulnar nerve. For the ulnar nerve, reference electrode we can put behind the medial epicondyle of the humerus. There are three muscles which is supplied by ulnar nerve: flexor carpi ulnaris, abductor digiti minimi, opponens and flexor digiti minimi. This is the motor point for the flexor carpi ulnaris muscle. Action of flexor carpi ulnaris is flexion with ulnar deviation of the wrist joint. This is the motor point for the abductor digiti minimi muscle. The action of abductor digiti minimi is abduction of the little finger. This is the motor point for the flexor digiti minimi and opponens digiti minimi. Action of flexion digiti minimi and opponens digiti minimi is opposition with flexion of little finger. Deep peroneal nerve, which can supply 5 muscles: tibialis anterior, extensor digitorum longus, extensor hallucis longus, extensor digitorum brevis and peroneus tertius. Reference electrode which we can place at lateral side and of the head of the fibula for common peroneal nerve. Tibial nerve which is supplied tibialis posterior, flexor digitorum longus, flexor hallucis longus, gastrocnemius and soleus. For the tibial nerve, reference electrode we can put on the popliteal fossa. This is the motor point of the lateral head of gastrocnemius. Action: plantar flexion of the ankle joint. This is the motor point of the lateral head of gastrocnemius, and this is the motor point of the medial head of gastrocnemius. This is the motor point of the soleus muscle, which is plantar flexion of the ankle joint. This is the motor point of the soleus muscle, both side. Now is common peroneal nerve. There are two branches of common peroneal nerve. First is superficial common peroneal nerve. Second is deep common peroneal nerve. There are two muscles which is supplied by superficial common peroneal nerve. First is peroneus longus. Second is peroneal brevis. Both muscles have a same action, elevation of the foot when the foot is off the ground. This is the motor point of peroneus longus muscle, and the action is elevation of the foot when the foot is off the ground. This is the motor point of the peroneus brevis muscle. The action is elevation of the foot when the foot is off the ground. Deep common peroneal nerve, which is supply 5 muscles: tibialis anterior, extensor digitorum longus, extensor hallucis longus, extensor digitorum brevis and peroneus tertius. Reference electrode for the common peroneal nerve we can place at lateral side of the head of fibula. Muscle which is tibialis anterior, which is supplied by deep common peroneal nerve. Action is dorsiflexion and inverter. This is the motor point for the extensor digitorum brevis. Action is extension of the digits. This is the motor point. For the facial contraction, reference electrode we can put at the C7 cervical spine. This is the motor point for the frontalis muscle. This is the motor point for the corrugator muscle. This is the motor point for the orbicularis oculi muscle. This is the motor point for the nasalis muscle. This is the muscle for orbicularis oris. This is the motor point for the mentalis muscle. This is the motor point for the buccinator muscle.